Of the Fourth Estate, good afternoon, and once again also let me also apologize alongside my colleague for the slightly late start. Fellow Kenyans, the number of cases of COVID-19 has in the recent days risen sharply countrywide, signaling an urgent need to review and emphasize some of the mitigating measures put in place at the end of June of this year. Recent data from hotspot counties in Nyanza and Western region show that if we stick to measures that we give, it is possible for us to see a decrease in the number of severe cases. However, we are observing an increase in cases in other counties, including Kiambu, Kajiado, Lamu, Makueni, Murang'a, Nairobi, Nyandarua, Taita Taveta, and for the first time also Tana River County. This observation is consistent with the projections of increased spread of COVID-19 in the month of July and August, associated with the more transmissible Delta variant becoming the dominant strain in our country. This morning, the National Emergency and Response Committee on Coronavirus held a meeting to review the obtaining situation on COVID-19. The meeting considered recommendations from the National COVID-19 Modeling Consortium following their meeting held yesterday, Thursday, 29th July. In view of these developments, NAC wishes to emphasize some of the presidential directives which are still in place and some new ideas. In line with the directive to avoid crowded places where transmission has been shown to be more likely, we once again emphasize that all public gatherings and in-person meetings of whatever nature are suspended countrywide. In this regard, all governments, including intergovernmental meetings and conferences, should henceforth be converted to either virtual or postponed. And there are several meetings that even the government itself had planned in the coming 30 days. All forms of physical congregational worship in the country, churches, mosques, and temples, be permitted as per the guidance of the Interfaith Council and the interfaith protocols that have been developed, but which in the recent past seem to have been abused. In-person worship should be limited to 1/3 of the capacity of the venue in strict adherence with the guidelines and protocols of the Ministry of Health. While indoors, maintain a physical distance of at least 1 meter between people. It is not enough that we have 1/3 of the people inside the church. The idea is to distance. That's why we have got 1/3. So there should be at least 1 meter between people. All restaurants and eateries to ensure that they operate in strict adherence to the protocols provided by the Ministry of Health. Again, there seems to have been a move backwards as far as that particular measure is concerned. There will be strict adherence to the measures. The hours of the ongoing national curfew to continue across the country from 10 p.m. and 4 a.m. This applies now to the counties in the Lake region as well. All employers, including public and private sector, government offices, business and companies, be directed to allow employees to work from home with the exception of employees working in critical or essential services until further notice. All healthcare workers are directed to use the recently revised Ministry of Health national guidelines for case management of suspected or confirmed cases of COVID-19. Members of the public are strongly advised against self-medicating and the use of over-the-counter medicines for treatment of respiratory tract infections and to seek medical attention from qualified healthcare workers. We have lost a few individuals as a result of not following this particular measure. We continue to implore all Kenyans, including those who have received the COVID-19 vaccines, not to let their guard down and urge them to avoid unnecessary movements and gatherings, employ physical distancing, observe strict hand hygiene, and the proper passionate use of face masks both indoors and outdoors. Recent reports globally indicate that even persons who have been vaccinated can contact the virus. The difference is that those who have been vaccinated are getting the disease but with less severity. So it is advised that whether you have been vaccinated or not vaccinated, that you observe the rules as have been spelled out. As the government continues to make every effort to avail vaccines, we strongly encourage Kenyans to get vaccinated against COVID-19, as will be guided from time to time. The vaccines that we are expecting in the next week or two will follow the same pattern that we had before. The above 58s, persons with comorbidities, individuals who are frontline workers, and so on and so forth. The committee also noted with concern the weak link in the fight against the epidemic is a non-compliance of individuals to containment measures and protocols and enforcement of the same. The committee therefore urges every Kenyan to take individual responsibility and be part of the solution. And today, what we would like to urge is that every stakeholder, every institution, to bring in their own areas the theme of be part of the solution. Do not be part of the problem. Be part of the solution. As individuals, we must ask ourselves whether our behavior is contributing to the solution or our behavior is contributing to the problem. We continue to emphasize that it is not possible for police to police every individual individually. And therefore, where there has been success elsewhere, where there has been success globally in maintaining and containing this virus, it is because individuals have taken up upon themselves to be part of the solution rather than part of the problem. Further, the committee noted that the response to COVID-19 is not just a health matter and has encouraged all sectors to get involved, and specific sector leads in government and private sector to engage their respective stakeholders in defining the enforcement measures required. Sectors of particular interest are trade and industrialization, transport, education, interior and interfaith council. Sectors will lead in addressing the country on these measures in the following few days. With regard to the education sector, the current evidence and data does not reflect increased cases among learning institutions, notwithstanding the morbidity and mortality among school-going children has been extremely low. For that reason, and in the meantime, to ensure safe and continued learning in our education institutions, All teachers are strongly implored to present themselves for vaccination against COVID-19. This is to safeguard not only the future generation by ensuring that we continue with the education in our schools, but also is to protect the teachers themselves, particularly those of above 58 who we have continued to implore to work from home. With regards to counties, as the government makes arrangements to install oxygen plants, counties are urged to ramp up efforts to install oxygen piping in their healthcare facilities to ensure maximum utilization of the plants. There are about 23 counties that are going to be receiving oxygen plants by the end of August. And for them to be effective, for the plants to be effective, there has to be piping in the hospitals where these oxygen plants are being installed. And therefore, as far as those counties are concerned, and indeed in all counties, what we are asking is that we pipe the oxygen instead of relying on oxygen cylinders. This is because, as we stand currently, our hospitals are fairly full, and we want to emphasize that the saving grace in most of the case management is the presence of oxygen or the availability of oxygen. Experience in other countries also showed that those countries that had sufficient oxygen managed to save more people than those without. And it's not just oxygen, it's oxygen that is properly examined, of a quality that passes the standards that we have set to ensure that people are saved. We urge the counties to actively also ramp up the necessary infrastructure, including the critical care facilities, the isolation centers, human resource, and testing capacity. And in terms of the testing capacity, the national government will also be placing PCR test capacities across the counties and increase over and above the over 20 testing facilities to make sure that almost every county has got a testing facility. Counties are also urged to ensure that they have adequate PPEs in all the hospitals, including the level 2 and level 3 hospitals, where more and more people are presenting themselves. And for the healthcare workers to ensure that as a matter of procedure, as a matter of regular work, they stay protected with the proper PPEs, because persons are walking into hospitals, and if you contact the disease at that point, then we have the same challenges that we began at the beginning of this year. And in this regard, the Ministry of Health has also directed that KEMSA supplies PPEs to counties, even if, despite their pending bill status, because there are counties that are saying that they are unable to get PPEs on grounds that they have not been paid by the Treasury. In turn, KEMSA is refusing to give them, so NAC has directed that it doesn't matter whether a county has paid his account or not, let every county be given the PPEs that are required for protection of our people. And finally, is to ensure that we enforce the 72-hour period of disposal of our deceased persons, and to ensure that licensed funeral homes adhere to these guidelines. One of the reasons why this is so critical is because of, as people, if we have people staying in hospitals for too long before disposal, what is happening is that then people start funeral meetings, and in those funeral meetings, we are experiencing increased transmissions. So we would urge that within 72 hours, we try and rest our loved ones. And we are grateful, particularly to the Muslim community, because of the examples they have shown in terms of disposal in accordance with their religion. but also we would urge the rest of Kenyans that this is one time when we would urge that no matter how we feel, no matter how pained we are, we still need to adhere to the rules. And the funeral homes, including government, mortuaries, and institutions, have been asked to ensure that this is what has happened, and this is what should be done. Again, on the issue of funeral services and burials, we have also emphasized that GAO will forthwith, and they will be calling a meeting, Interior will be calling a meeting to discuss this matter with chiefs, sub-chiefs, and other enforcement agencies to ensure that funerals are attended by the 50 people that we had proposed earlier, because if we do not follow those protocols, then we will be going to bury our loved ones and then follow with more funerals of the same people from the same families, as has been evidenced in some of the cases that we are now dealing with. So, ladies and gentlemen, the main issue today was to deal with the situation as we see it, to emphasize some of the measures that are already there, but also to warn that we cannot hesitate to take even further measures if we see that the adherence to the measures that we are taking are low. Of importance is also the emphasis on the stoppage of gatherings, even those of a political nature. And I want to emphasize here again that we want to be part of the solution. And we are asking those in politics, those practicing political meetings, to be part of the solution instead of creating epicenters of spreading of the disease. So I want to pause there for a minute and ask the IG to weigh in on this issue as I come back with some of the other figures that exist, that we have today. Let him sanitize.
Thank you, CS. Mine is directions and instructions, which I want to give today to all the commanders and police officers of National Police Service across the country on 2 directions and instructions. All the protocols, CS Mutai Kagwe has highlighted them. The National Police Service is to enforce that all these protocols are complied. And in that regard, I give instructions to all officers of the National Police Service with effect from today that all those protocols to be enforced and measures stepped up. We will take responsibility. Secondly, I'm asking all the members of public to cooperate with the police. You keep yourself safe, and I promise and assure you that you have no problem with police. Be in the right place at the right time. During the curfew, I would urge all the members of public to stay at home. I have no other new instruction I'm giving because my simple job is to enforce there's no public gathering, political rallies. We are not going to have discussion of these matters. Officers take instruction on this, including the commanders. Those meetings have already been prohibited. Ours is to ensure that no such gatherings which endangers the life of the other citizens. You play your part as members of public. The officers of National Police Service will also be able to cooperate with you. When you don't cooperate, we will use all measures to ensure that you are going to cooperate. All the protocols have been stipulated, highlighted. The members of National Police Service is to enforce them. And I give direction to all commanders to ensure compliance of all those protocols. Asanteni sana.
Thank you very much, IG. I think that the only other thing to emphasize as I conclude is that is to appeal to Kenyans that the reason why we are doing these things is now evident. A while back, we did tell Kenyans that it is important for us to have facilities, ICU facilities, and other facilities within the counties. Today, the Nairobi hospitals are stretched to a limit. And the truth of the matter is that if you fall sick today within this county, you are very unlikely to get a hospital bed. And it is good to call a spade instead of a big spoon, because the truth of the matter is that we are sitting between a difficult situation, we are sitting in difficult times, we are increasing the ICU capacity, we are increasing the ICU capacity in KU, in Kenyatta National Hospital. I am aware that Nairobi Hospital is also increasing its ICU capacity by some 20 beds. We are increasing by some 28 beds at KU. But the truth of the matter is that unless we can contain it at this level, unless we can stop the transmission right now, then it is possible that our health system is going to be overwhelmed. And when that happens, then you have got the scenes like you see in other countries. You saw it in India, where a person dies right in front of a hospital and there is nothing that the doctors can do. So this is not scaring people. This is more to emphasize the need for each person to protect him or herself. We need to protect ourselves, because as I said, you cannot afford to be taken to a hospital where there is no capacity to take care of you. And as we speak, some 400, and nearly 450 patients are on oxygen. They are on oxygen, directly on oxygen. And that is not including the 175 patients who are in ICUs. And as you know, most hospitals don't have that much capacity for ICUs. We have got 1,432 patients across the country who are now hospitalized, and that is not including the nearly 4,000 who are in home-based care. And as for the home-based care people, we are also saying, just because you are being treated at home does not mean that you do not need to check with the doctors and constant supervision to ensure that you continue to be safe. There are some people who deteriorate when they are at home, so those observing them need to make sure that the minute you see a person who is on home-based care begin to cough more or to get a bit sicker, then it is important for them to be taken to hospital immediately. Our positivity rate continues to be high. Today, as you know, yesterday we had over 14%. Today, we still have over 13% in terms of positivity rate. And those are high numbers, because what you are saying is that in every 100 people, 13 people are infected. And therefore, we continue to urge our people, all Kenyans, to be careful. And when you say 13 people, that's an average. So when you take an average, it means there are some counties that are very, very low and some counties that are very, very high. The document that the media is going to be given includes the positivity rates in terms of county by county. And some counties have got a high positivity rate, particularly the county that we are currently in. So we would like to urge care, and I keep on saying, let's be part of the solution, not part of the problem. I repeat what we said in this same place sometime last year. Let's never, ever, ever think that we can treat this disease normally. I thank you.
Thank you very much, Waziri. Ladies and gentlemen, it is your turn now to ask questions. Please remember your name and the media house that you represent.
Je, umepata chanjo ya Covid-19? Chanjo ya Covid-19 ni salama na inazuia athari za virusi vya corona. Hakikisha umepata chanjo zote mbili kwa kinga dhabiti. Hata hivyo, unashauriwa kuendelea kufuata maagizo ya kujikinga dhidi ya Covid-19 kama ilivyotolewa na Wizara ya Afya humu nchini. Kila wakati nawa mikono yako kwa sabuni na maji safi yanayotiririka au utumie kiyeyuzi. Vaa barakoa wakati wowote upo kwenye mikusanyiko. Epuka kutangamana na watu kwenye mikusanyiko. Chanjo ya Covid-19 inakukinga wewe na jamii yako. Pata chanjo, uepuke corona.